So over to you, without further ado, Michelle, and tell us about the important work that you've been doing.
So this is just a little bit of a background as to the project that we took on. So it was Healthwatch Darlington. Obviously, we're part of the Healthwatch network. There's 152 Healthwatches across England, and we're all funded by local authority area. So Healthwatch England is sort of like the mothership. They're there to support us, and they asked us if we could explore the potential inequalities regarding remote GP appointments during the pandemic. And we were asked to consider the impact of the new ways of working on people who may find it more challenging to access care remotely or virtually. So Healthwatch England were particularly keen for us to partner with our primary care network, with a particular emphasis on social deprivation. So if people aren't familiar with primary care networks, Darlington's PCN is one of the largest in the country and includes all of the 11 GP practices working together to improve the health of the borough's just under 109,000 population, including tackling health inequalities. So they'd already contacted us asking to work together with some of Darlington's marginalised groups who have been struggling with access during the pandemic. So Healthwatch England also commissioned another 4 local Healthwatch. So as well as Healthwatch Darlington, there was Healthwatch Dudley, Haringey, Swindon, Wigan and Leigh. So it's just to give them a broader look at what is actually happening across the country. So we were tasked with conducting at least 15 interviews with patients from relative social deprivation in our community from each of the following groups. So there's older people, people with disabilities and people with language barriers. So we held focus groups with professionals as well. And due to the pandemic at the time, but also as time has gone on, it was difficult not being able to speak to people face to face, because that's usually what we do. We're usually out in the community. So we aim to reach out to specific communities to obtain insight in how the new digital approach has affected people. And this did not mean actually that Healthwatch England or the primary care network could dictate to Healthwatch Darlington the areas of focus. That was down to us because we know our area. So key lines of inquiry or our methodology were all down to us. And we clarified this with Healthwatch England and the primary care network before embarking on the project. And so taking a partnership approach together, we had a greater impact on the health and care of local people. So if we go on to the next slide. So this is just to contextualise where Darlington actually fits. So we know that in the northeast economy is particularly affected during the pandemic due to the greater share of workers unable to shift to remote working. And recent reports exploring the impact of COVID-19 on the economic growth of Darlington highlights that the town is now seeing higher levels of unemployment since 1995. And it's believed that even more people are in employment. It's believed that even though people are in employment, that even more people are experiencing decreased earnings. And there is also an unexpected and notable growth in numbers of patients with mental health conditions, which is expected to increase as unemployment rises and growth falls. Darlington residents identify with over 64 different main languages. And the largest non-white ethnic group is our Asian population. And we also have higher numbers of Gypsy Roma travellers than the wider UK, with approximately 6 times the national average. And at ward level, 26.4% of the Asian population live in Northgate, which is one of our most deprived wards. So 12.3% of its total population, and it's considered one of the most deprived wards in Darlington as well as Central. So if we move on to the next slide. So with our findings, we did find that people find it more difficult to use remote methods for all of those reasons. And if people fall into several vulnerable categories, then the likelihood that they're digitally excluded increases. And participants often mentioned that they weren't interested in accessing healthcare remotely, even if they could. But rather than take that at face value, we need the system to continue to explore why people feel reluctant to take up remote offers, rather than whether they can or they can't. So if we move on to the next slide, please. So the summary of our local findings, I think on most occasions, the older patients, they received, the primary care treatment that they received was the most positive. However, some experienced no return calls upon using eConsult to book an appointment, which led to them becoming worried. They commented on calls taking a long time to answer before the pandemic, but since the first lockdown and then the second and then carrying on, the time to get through to talk to someone has increased greatly. And others became so frustrated with their GP surgery that they changed to another GP surgery within the town. And some were even weren't given any support or instructions of how to send a photo using the mobile phone. So it's just really simple things that people were getting really frustrated about. And also it was indicated that there's longer waiting times for community and secondary care, which was also mentioned by professionals further along. Older patients who were able to use the internet thought that it worked really well for them, but most people that we spoke to had no interest whatsoever in online services and were quite worried about the cost as well. It was something that they didn't think was needed within their home. And they also prefer to see a doctor face to face, just because they didn't want to be misdiagnosed and they'd be able to explain things properly to them. So if we move on to the next cohort of patients. So with our disabled patients, the hearing impairment patients who we spoke to enjoyed taking part in video calls. And there was quite a few people with hearing impairments, but they said that during online three-way remote appointments, only the interpreter is visible and the professional will be using audio. The patient does not find this effective, as they prefer to use facial expressions when communicating, and mostly the patient had been offered face-to-face by their GP surgery. So the GPs were aware of the barriers, and so, you know, most people were offered a face-to-face. Wheelchair users found the experience really good because they were able to book an appointment online as normal and able to take photos using a phone and email them over to the doctor, which was easy to them because they could do it in the privacy of their own home. And it also meant that it was just more convenient than having to travel to the GP. So, you know, these were just snapshots of patients that we spoke to, but the ones that we did found that the experience was really good. And then we come on to patients with learning disabilities. So some of them preferred face-to-face because they can see facial expressions, which would otherwise be a barrier by telephone. But then other patients felt really anxious because it's easier to use the phone, because they could become nervous in social situations. So all in all, there was a mixed response to remote appointments, but everyone we spoke to said that in the future, it's important to have some choice so that they can pick what's best for them. And disabled patients found regular text messages to remind them of appointments was really helpful. So if we move on to our next cohort of patients, so our Black, Asian and minority ethnic patients, speaking to these patients was particularly difficult to us because normally we would be out in the community, but because of COVID, we weren't allowed to do this. So it's usually difficult with the complexities and barriers that practices and patients normally face, never mind having the pandemic as well. A lead GP practice that usually sees a lot of the Asian community found that they were disengaging with the practice due to the myths surrounding COVID-19 at the start. And the practice had been told that this community group are extremely frightened due to the pandemic. So although digital exclusion is a barrier for this patient group at any time using health services, the current situation made it difficult for any service to engage with them, as they'd closed off the usual communication channels. So the practice created a new initiative inviting women from Asian communities to find out more about services that can help in a safe and comforting way, using a trusted and respected third-party advocate from the community. who acted as a translator, and this has helped the practice to engage on some level, but they admit there are still many challenges to face. So from a Healthwatch Darlington point of view, we contacted a Healthwatch volunteer who is also a Darlington Borough Council ward councillor, and for the Northgate area. And she's also a prominent member of the Black, Asian and minority ethnic community. And there were various languages, including the local dialect of Bengali, Arabic, Polish, Punjabi and Urdu. And the information gathered by Councillor Ali reflects the difficulty people from these communities face when English is not the first language and technology is not used due to language barriers. So children often try to help with online calls and connections, but this creates frustration and problems within families. And most respondents were unhappy with telephone or video consultations because when the doctor said he would call back, no time was allocated. And this caused stress and frustration due to many of the patients needing language support. Also, extra pressures on mental health and physical well-being were cited by several patients we spoke to, as many of them are incredibly vulnerable and they felt they were being isolated due to their language and cultural barriers. Also, having to make a call to the GP practice was a huge task for some people, and since their first contact was an automated call system, they struggled from the onset, often having to use their children to help them communicate to get through to the booking appointment stage. And some of the issues that they were calling about were very sensitive, which can be embarrassing, having to speak through a third party. And they felt that these needed to be discussed with a doctor. Many Asian women find it difficult to talk to a male doctor, so when they call, they want to be able to speak to a female doctor. And also when ordering a repeat prescription, it was even harder as it had to happen over the phone and they could not explain all the medication details that were required. Due to the length of some of the spellings of medication and not being bilingual, they struggled on many levels, and some struggled with their own languages due to not having the privileges of a basic education. So there was a lot of problems with trying to get previous prescriptions, because they couldn't go to the GP practice with a repeat prescription in their hand to show them. And for those people with who were heart patients, diabetics, or on treatment for chronic conditions, or who had children on specific medications, this was extremely concerning for them. So next slide, please. So with the professionals we spoke to, they actually welcomed the changes within the practice due to the shift to remote consultations, which included time saving, helping more patients and convenience. However, they did recognise that offering remote consultations is not suitable for everybody, and especially the people that the cohort of people that we were speaking to. They know that there's also waiting times for secondary care referrals, and which means primary care professionals are dealing with follow-up calls and frustrated patients who want to be seen by secondary care. The added demand on telephone appointments means that some patients are either not being seen as quickly or are just not bothering to ring the doctor. So health professionals are also worried about the long-term implications of older patients who have gone without social contact for a number of months as well. So there is quite a lot of worry within the professionals about not reaching out to those patients who they would normally see just because of remote access. So if we go on to the next slide, there's a list of local recommendations there. Now, this was just a snapshot in Darlington. And so the recommendations that we put forward were those, as you can see there. We do think that health and care services should continue working together, particularly for those that are vulnerable or experiencing disadvantage. We want to ensure that the momentum of communities working together during the pandemic is supported going forward for more joined up approaches. There's some amazing people out there doing amazing things. We want to keep that going. And the sharing of resources and community assets to find solutions for those more socially deprived. Also, the provision of digital access through perhaps libraries, community centres, health and care services going forward. Health and care commissioners continuing to work together to explore ways to reduce the cost of digital services for our communities. Digitally excluded risk losing their voice and access to services as more emphasis is placed on online solutions. So GP services must ensure they have the necessary communication methods for all of their patients. And we also recommended that GPs review their accessible information policy and translation policy, ensuring that there are clear focus on the support available for non-speaking English patients. So if we just quickly move on to the next slide. This was Healthwatch England's 5 principles post-COVID digital healthcare, and this was also taken into account with the other 4 health watches that were giving their findings to Healthwatch as well. So as lockdown measures are lifted, it's vital that GP practices are offering face-to-face appointments and that appointment bookings can be made by phone or by coming into reception, with practices open to the public. Practices should respect patients' preferences from face-to-face care unless there are good reasons to the contrary. For example, if a patient has COVID symptoms, giving people the choice to say what is the right appointment for themselves. And it's not about giving people what they want, but a vital way for the system to manage people's varying needs more effectively. And this is in line with the most recent standard operating procedure for general practice issued by NHS England to support the restoration of general practices in the future. And for the second one, whilst not everyone will have the capacity or desire to access remote or digital care, we know that the right training and support can help people who were previously digitally excluded at home to get online. So there are many examples of successful local initiatives, but ultimately such initiatives should be left up to local discretion. The NHS must make a commitment to improving digital literacy central to its post-pandemic recovery strategy. The third one is we have previously called, Healthwatch England have previously called on NHS England to undertake a formal review of the ways people access general practice services to make sure they work for everyone. Part of this should include development of a code of practice clarifying patients' rights to receive services online or offline. Our research showed that there is currently a wide variation in local practice regarding new practices in how practices integrate remote appointments with the support which people are legally entitled to, such as foreign language or British Sign Language, or information available in accessible formats. And these approaches need to be standardised. For example, making clear that the NHS should be commissioning telephone interpreters, and more broadly, NHS England should produce a single vision statement clearly setting out national expectations for the role that remote care will play in the transition out of the pandemic and in the future. And for the fourth one, in our research, both patients and staff suggested that it would be helpful for practices to code patient records with information regarding a patient's language and communication needs or level of digital skills, so staff can be proactive about offering people in an appropriate consultation type or preempt requests for adjustments in the future, and work should be undertaken to investigate how patient record systems can support this. And then finally, if the NHS is going digital, there can be no excuse for allowing cost to create a permanent barrier to accessing vital public services. In its recent report, Beyond Digital, the House of Lords COVID-19 Committee argued that internet should now be considered as an essential utility in the same way as water or electricity. The committee recommended that the government consider introducing a legal right to internet access and give people a ring-fence benefits entitlement to specifically access affordable internet. We agree that the national ambition to provide digital first primary care to everyone should be underpinned by a universal right to internet access, ensuring the NHS remains genuinely free at the point of use. So if we just quickly go on to the next slide, there's links there for the two reports. So the first one is the Darlington one, and the second one is the Health Watch England report, which encompasses all of the Health Watch's evaluations and recommendations. And then on the next slide, there's just, if you just move on to the next slide, there's external data of relevance. So there's just a whole heap of things there from the Health Watch network and people that we've worked with that might help with this topic. And so that was just a whistle-stop tour, and I hope that I didn't speak too quickly because there was a lot to get through, but hopefully it proved useful.
Thank you very much, Michelle. Lots and lots of really interesting information there. I've noted down one or two things myself. And you won't have had time to review the chat box, but there's lots and lots of really good comments, links to reports, insights from other participants based on what you've been sharing with us. So that's absolutely fantastic to get that richness going. That richness means we are already a little bit behind time. That's fine. I'm going to press on and I'm going to introduce Adam Parnaby next, who's going to talk to us about some of the lessons learned from the regionals VCSC sector. Adam.
Hello, thank you, Dave. As was just said, I'm Adam Parnaby. I'm a doctoral candidate, which is a fancy way of saying PhD student at Open Lab at Newcastle University. And I'm going to talk to you very quickly about some research that I did in close collaboration with Vaughan and with Not Equal, who are a UKRI funded research network focused on social justice in technology. So if I can get the next slide, please. So what the work that we did that I'm going to be talking about today was in effect a qualitative mapping exercise with VCSE practitioners doing digital inclusion work broadly defined in the Northeast. And so what we did is invited people from a range of different organizations who were serving a range of different stakeholders, a range of different citizens, from urban areas, from rural areas, from groups with particular protected characteristics, for example, so a range of different perspectives. And we got them together to discuss what was working well, what wasn't working so well, what assets the sector has in doing digital inclusion work right now, because a lot of that work is already ongoing and it's already fantastic, and I'm sure you'll hear a lot about it today. And also what the bottlenecks were, what things could be changed that could improve things. And from this, we developed a set of recommendations to serve as a way to design responses to the current situation based on and taking advantage of the work that's already happening. So if I can get the next slide, please. So I do want to say very quickly, this research took place in the run-up to and during the second UK lockdown. So necessarily, it took place in a format much similar to this event. It took place online. That obviously affected the kind of input that we could get. The people that we did get, however, were very experienced. In many cases, there were people who spend all day, every day, supporting people to access various things online, not just healthcare, but a range of different services. And I also want to highlight, as you'll hopefully see, most of the things that I'm going to talk about today, whilst this research was in some respects a response to the pandemic, were not specific to the conditions of the pandemic. These are things that were true before the pandemic, continue to be true now, and would be true if the virus were magically eradicated from existence tomorrow. If I can get the next slide, please. So I'm not going to go exhaustively through all of the findings from this report. I would highly encourage you to read the whole thing. There's going to be a link on the last slide. But I do want to highlight a couple of things in here. So one of the activities that we did was to collaboratively produce a set of values that people should adhere to when doing digital inclusion work. And I've put the thing in its entirety on the screen here, but there are two that I really want to highlight that I think are particularly relevant to the discussion that we're having today. The first of these is to inform beneficiaries so that they can make decisions. For a beneficiary to be able to make an informed decision about accessing a digital service, about being digitally included, it logically follows that they need to have another option. They need to have a non-digital option. And therefore, part of digital inclusion work, I would argue, is to preserve offline options. That's something that's really key. That's something that we've already heard a couple of times today, and I'm sure we're going to hear it more, but I just wanted to highlight that. Also, this point about making things inclusive and accessible. when we talk about inclusivity and accessibility, that is often framed in terms of disability. Obviously, that work is critical. It's also, it's heartening to see increasingly framed in terms of language. But there are things that I would sort of add to the plate here. Things like designing services in such a way that they're inclusive and accessible to people experiencing data poverty, people who can't afford to have unlimited bandwidth, people who have lower digital skills. There are ways that we can design our services. And if you want to have me to talk your ear off about this, do email me. There are ways that we can design our services to make life easier for people who are being digitally excluded for reasons other than disability and language, and in some cases, in addition to disability and language. Next slide, please. So now I'm going to start going over in broader strokes some of the key findings from the report. So the first thing that came up again, and is probably about a third to half of the report by volume, is that digital inclusion work is just really complex. And by that, I mean that there are lots of different things that need to go right for a person to be digitally included. You need sufficient connectivity, you need a device, not just a device, but the right device. Anyone who has tried to apply for a job on a smartphone will be able to tell you that it is not fun. You need the right skills. You also need the content to meet you where you are in terms of accessibility. You need adequate support for when things go wrong, and they will. And you need a sense of confidence, a sense of safety, a sense that doing things in the digital way is something that you are comfortable doing, something that you should be doing. All of these things are context dependent. All of these things depend on what kind of activities you're doing. So they'll be different in health than they will be in schools, for example. And all of these things require different responses, which brings me on to the next point, if I can get the next slide. So if any of you are aware of any single organization that can do all of the things that were on the last slide perfectly, that can take someone from having none of those things to having all of them to a high standard, please do get in touch with me, but I do not believe such an organization exists or is likely to anytime soon. So what that leaves us with is cross-organizational collaboration being really key to provide good quality service in terms of doing digital inclusion work. And practitioners in VCSE that I talk to want to do this, the will is there, but they don't always feel that they have the tools, the environment, the know-how to work in those kind of radically collaborative ways. Often in the VCSE sector, people find themselves being pitted against each other for funding, which makes people reluctant to share know-how or to share credit. It's also just difficult to share data, especially with GDPR and other such things. And also some of the people that VCSE sector people that I talk to would really like to work with don't necessarily understand the scale of the problem. So the quote on the opposite side of the slide here, I'll briefly summarize, was from someone who was talking to a high up decision maker in a very relevant government department. I won't name which one, but they said that digital inclusion wasn't high on their priorities because people can get cheap broadband deals. And this was a conversation that took place during the pandemic. So what that tells us is that for those of us who do care about digital inclusion, there's more work to be done convincing people that it's something that they should care about too. That means data, that means new techniques for storytelling, that means arguing persuasively and collectively. And also there's a role for technologists and people in industry to play, the people who are designing digital services, in making their services more accessible from not just a disability perspective, but a digital inclusion perspective. So we often think in digital inclusion, I'm just as guilty of this as the next person, about a deficit model. We feel like there are people who have insufficient skills or infrastructure, and if we give them the skills and give them the infrastructure, then we can get them to do the work. We can put the onus on them to rise up to meet the barrier to entry. But of course, there's another way of tackling this gap, which is to reduce the barrier to entry. And for that, we need to engage with technologists. We need to think carefully about how we're designing things. Again, happy to talk your ear off about this. Please do email me. If I can get the next slide, please. Coming towards the end, I just thought I'd point out a couple of really kind of key pragmatic current challenges that the VCSE sector is facing in doing this work. To be clear, the VCSE sector is doing digital inclusion work, has been for a very long time. A lot of that work is brilliant, but these are ways that it could be improved. So one of these things is to support that kind of cross-organizational collaboration coordinating the sharing of know-how, the sharing of data and case studies and tools, both to improve practice and to argue persuasively to key decision makers to get them around the table. This is what my work is in the beginnings of focusing on at the moment. If you want to hear more about that or get involved, please get in contact with me. I would love to talk to you. There are also some thorny issues around safeguarding and security. This is particularly relevant here today. If somebody can only access their online health services in a community center or a library with a volunteer who is well-meaning but a stranger to them, hovering over their shoulder, showing them what to click, there are obviously some thorny safeguarding and ethical issues there. And that volunteer is not necessarily at the moment well supported to make those judgment calls. So there's more work to be done there. Also, just the pace of innovation is something we always need to keep in mind, because these interventions that we create are often only relevant for a short period of time as technology changes. Nobody who was teaching digital skills was teaching people how to use Zoom until March 2020. That's an extreme example, but that kind of thing happens all the time. And if I can get the next slide. So finally, again, there's a lot more detail in the report. I would highly encourage you to read it if you're in any way interested in what I've just said. There are some key recommendations that we made. One is to recognize the complexity of digital inclusion. This is hard, complex work with a lot of difficult to answer questions. It's what we might call a wicked problem. And then it follows from that we need to be able to support an ecosystem-based approach. So that means working with multiple organizations that can share good practice in the particular areas where they're doing well. Funding collaborative projects, keeping in communication with other people that are engaging with the beneficiaries of our own services, getting technologists and developers around the table. I came at this from a technology and development background. That's my background. If you are a developer here today, again, would love to talk. Finally, providing training and support for practitioners to deal with some of these complex challenges. A lot of the people doing this are volunteers, doing it out of the goodness of their own heart, and they don't necessarily feel comfortable or confident making the difficult decisions that they need to make every day to help someone, for example, access their healthcare services online. So that's my piece. Thank you very much for your time.
Thank you so much, Adam. This is Charlotte. That was such a valuable presentation and some really great insights there. And I felt myself after every paragraph going, yes, yes, yes. The chat's like alive. Have a look at it back. And there's some great people that are reaching out to you and really keen to understand more about your work. And I'm definitely one of them. I'd love to pick up a conversation with you after the event. Thank you so much. And next up, we've got Lindsay Henderson, Head of Communities at Your Voice Counts, who's going to take us through the role of self-advocacy groups in Your Voice Counts. Thanks, Lindsay.
Hello. Can you see me? There's the camera working, I think.
Yeah.
Hello, everyone. That was really interesting. So hopefully this will be equally so. Could I have next slide, please? So my name's Lindsay. I work for Your Voice Counts, which is based in the northeast of England. So we've got a base in Gateshead, and we've been around for 30 years, set up by kind of carers and family members of people with learning disabilities back in '91. We currently provide statutory services, statutory advocacy services across Newcastle and South Tyneside. And we work with people with learning disabilities, autistic people, people with mental health challenges, and people who are vulnerable due to their disability and old age or illness. And we provide some support to their family and carers. Our main aim is to help people to be better connected to their communities. So digital inclusion is really important, and make sure that they have choice and control in their life and can speak up for what they want, which is the advocacy side. And our experts by experience are at the heart of everything that we do. Next slide, please. The communities team, which I'm responsible for, work across Gateshead and South Tyneside, and that's where a lot of our digital offer has been born through absolute need during the lockdown. So we provide one-to-one support, and we offer kind of support in crisis, and that can be people who are coming to us with benefit issues, housing, all sorts of other kind of immediate concerns. But we also support people who just want to build their friendship networks, who want to do something meaningful in their local community. And so we put drop-ins on, we have group activities, and they were a lifeline for a lot of isolated people. And during lockdown, obviously that stopped. So some of those activities continue online and in person currently. We also offer employability support. So we have a Wise Steps jobs coach who offers support to people with learning disabilities to access volunteering and work. We have an involvement team, and we're focused on trying to understand the needs of our learning disabled and people with autism, that community, what they need, what needs to change in their local area. And we offer peer-led training support in order to try and do that and raise the awareness to commissioners and to other service leads. I mentioned quality checks in the chat earlier because we work, currently we're working in South Tyneside doing NHS quality checks in the 21 surgeries. So if anybody's interested in that provision where people with lived experience of learning disability go into surgeries to ensure their accessibility, we find that is great, and I'd love to talk to people about that. There's other learning disability charities who offer that too. We also run a self-advocacy group. So Speaking Up Together is across South Tyneside and Gateshead now. Your Voice can support them to develop their own user-led groups and activities, and that is very much led by them, and they're involved in a lot of campaigning work, particularly around the ongoing abuse experienced in some assessment and treatment units. So in short, I think as a service, we're really also really proud that we employ people with lived experience, and there's a lot of our colleagues who are taking leadership roles now, and we try to encourage that across the services we work with externally too. So the reason why I'm here, next slide please. We're talking about our getting online experience and the barriers that we've faced. So as I said, in lockdown, face-to-face work just stopped, and some of the people that we're working with, it's a lifeline to come along and see. Sorry, the chat's really when it's a direct question, the chat can be quite discriminating. Yes, we do work across Gateshead, South Tyneside and Newcastle. So during lockdown, we had to look at a different way to ensure that people who found our services a lifeline. So we started to telephone people, and we made welfare checks, making sure they were safe, they understood the COVID guidance, all of the complexities around that, because there was limited information in accessible format initially. So from that point, we realised we weren't getting enough information, we weren't actually seeing people, some people just weren't responding over the phone. So we had to look at a way of accessing and trying to get online. We did a survey with all of the people we worked with. We talked to them about how did they feel about online activity. And a lot of people, again, echoing some of the comments that have already come forward, we found that some of those people had no devices, and that was either because they'd never thought about owning one, like a smartphone, or they just didn't have the money in order to purchase one. There was potentially no Wi-Fi. We know that in some of the projects that people lived in, supported living, there wasn't good Wi-Fi for people to be able to access that right away around the buildings. And again, it's a finance issue that some people couldn't afford it. When we were telephoning, sometimes people were gatekept by potentially providers, carers, families. Everyone was really busy, worried during the lockdown. And that was through maybe fear of the risks of being online, and actually the actual risks of being online. So when we're talking about cyberbullying, the scams, all of the negative aspects were heightened, and because the people we work with are very vulnerable with learning disabilities, it seemed to be the go-to was like, let's not make them more vulnerable by going online. And finally, there was also a kind of workforce question, which was about people we worked with. They didn't have the understanding or skills to go online themselves, but also the staff potentially who were working maybe in the supported living schemes, or generally our staff as well, just did not have that support in place to get people online. Next slide, please. So the solutions we came up with was getting some funding. So for the devices, we were lucky enough to get short-term funding from the Police and Crimes Commissioner, and that was the Northumberland Police and Crimes Commission, and we managed to purchase around 35 devices for people who we supported. So that was tablets, it was smartphones, which gave them the actual devices to get on, and it funded for 6 months. It had Wi-Fi access, so we had data, we could provide the data as well. We developed accessible information, so easy read guides that people could use so they understood how to get online. It was step by step. We developed some, but there was also some really good stuff existing already, such as ACE Anglia had developed some very good information. We had a designated expert, basically. Amy, who you'll see on the video I'm going to show, she did a lot of research, she looked at devices, she looked at gadgets, and that led to us using a Microsoft Team viewer. That was absolutely brilliant for the people we worked with as well as our staff. We were all trained in using that, which allowed us to access other people's devices with consent, so we could actually show people remotely how to use the particular devices, get on WhatsApp, etc., etc. We had to problem solve with some of the gatekeepers I've mentioned before. It was helping people not be frightened of using the devices, to show that we were serious about assessing the risks, and we did some workforce development with people as well, trained them and helped them build their confidence in getting online. For the person themselves, we were really focused on measuring the risk and helping them manage the risk. Next slide, please. So in order to manage the risk, of which there are many, there are a lot of risks in place, we needed to talk through and have detailed conversations, developed a risk assessment with everybody who we were working with. And that was regarding each risk, and it was working with the person, it was working with people around them, their family, their unpaid carers, their support staff, just to try and understand and mitigate each of those risk areas. We would put training on, or we would bring online safety training in, working with partner agencies around the region. And we developed peer support groups for the people we worked with, as well as our staff. And we made sure that we had weekly check-ins in order to kind of just check through some of the glitches that were happening and working through that. Easy read, accessible safety information was key, and just making sure that people understood what those issues were. And we couldn't stop continually ongoingly reviewing that particular risk itself. So we had to have those ongoing conversations with the whole team and the people involved in their care. Next slide, please. So I think I've got 2 films that would like to play, and these kind of just show the impact, I think, more than I could ever do in anything I say. And I noticed Julie from Digital Voice on there. We've eventually launched these, Julie, so we've launched these this week. And Margaret is a woman who's an older woman, and she's visually impaired, and Peter is one of the guys based over in South Tyneside, and both of these people have gone through a huge learning curve and have benefited massively through our digital support. So before I sort of share the videos, I'd just like to say that we have launched them on our website. We're sending out information and the links to the videos to all of our local councillors, to our MPs and other people, just to try and raise the awareness of the importance of digital inclusion, and also some of the key things that we've learned, which we've shared. I think learning disabilities doesn't necessarily mean you can't have online skills. Digital poverty is a huge issue, as is access to Wi-Fi sometimes, and therefore investment needed, which is kind of definitely picked up on some of the comments earlier. And I think being online can be safe with proper skills, both for the person who wants to get on and the staff around them. Workforce development is an essential. So it would be really good if we can continue this conversation. That'd be great. So could we play Margaret's story?
I was very depressed and very low because there was a lockdown and I didn't understand everything. And it was very dull because I was very low and I tried to do things to myself through the depression and other things. Being in the house and not getting out and not seeing my friends, my mental health wasn't very good at all. At first, I had no help at all. Eventually, I got help from your voice count.
Hello, Margaret.
Hello, Amy.
I've got your tablet, look.
Thank you.
I said I'd come and drop it off,
Yes,
didn't I?
yes.
Shall we have a practice
Yes,
while I'm here?
yes.
Let's do that, and then I can show you how it works a little
Right,
bit.
okay. Amy brought us the tablets. It was on loan at first, but it's mine now. The phone just to make sure I was all right and chat to us on the phone and make sure I was all right and I wasn't getting too low or anything like that. That's right, you did. It's helped me a lot because I live on my own and I got no family now, only good friends. No, I know I didn't. A lot more confidence in it because I'm learning how to use it now and looking up things what I couldn't look up before because I can learn different things now on the tablet. You can get Irish music on and music what I like. Danny O'Dolan, Foston Allen, Sean Wilson. Oh, I dance and sing. I go to a group on a Wednesday. I've been coming for nearly 4 weeks. And we do all different kind of things, reading, spelling, writing. I'm typing about friendship, how you can make friendship and how it's good to have a good friend who you can talk to and confide in.
We could get you online, you could do some literacy in that.
It's lovely to get back to the group. It's the first one that started back through the lockdown, so it's good signs. And we're on the move in the right direction now.
Thank you. Are we able to play Peter's? Yes, fantastic.
I was feeling angry. I was feeling very angry because I had nobody to talk to. I couldn't go to me meetings. I couldn't meet the other people. So it was like you were locked in a shell and you couldn't get out of it. And you looked and you say, well, this is going to drive people crazy, this, if they don't get on. So they said, right, you need to go on one of these. And they were sorting something out, and all of a sudden, Amy came and she says, oh, Peter, I've got something for you. The phone. Wrote that down, and I can get on WhatsApp.
Well, I'm very happy for you.
All my courses will come through on here. Like tomorrow, I'll have one. And it'll be my minders will come through on here. And then we catch up on the afternoon. And then I got one off WhatsApp, which is the little green telephone. And you press it. Right, okay, then I go there. And somebody's made the cooking online. So now I can do cooking online, which I never did. It's nothing to be frightened of. You can do it online. You can do it. Long as somebody shows you how to go in. Now, everybody in our group have now got either a phone or a tablet. It's just great, magnificent how it's brought the glory out of me and all my friends and saying, go on it. There's nothing frightened. You're going to meet all your friends online. Now I can just go on WhatsApp, Flight Track, the lot, There's something on its way up to either Durham or Newcastle. So if I press on Arnold's going to Tayside from Bryce Norton.
Thank you. We have our contact details the next couple of slides, and just please get in touch. I think it's so important to see. I think if you witness people who've been so isolated for such a long time and then see their faces when they see their friends, it is just heartwarming. So thanks for the opportunity to share. And if you're interested in helping, go onto our website and retweet all the links about the digital toolkit. Thank you.
Thank you so much, Lindsay. Inspirational videos there at the end. Once you've shared it, you must tell us if we can share it via our networks as well. So I think it really brings the importance of this kind of session home, doesn't it? It's at the end of the day, we're all here to try and support people. So that's absolutely fantastic. Thank you very much. I realise we're a little bit behind, but behind the scenes we've been hatching a plan to not lose any of the presentations or the important time for conversation, and we'll cut down some of the other bits later on in the session. So next up we've got Anya and Richard, who I believe are doing a bit of a double act. So Anya and Richard, could you there?
This bit's definitely mostly Richard with a little bit of me on the end.
Okay. I shall allow you to take the double act yourselves.
Anya, are you starting?
No, the first bit's all you, Richard.
Okay,
just to
right,
say that
fine.
we were all. This is all about thinking about other elements that we need to consider.
Yeah. So yeah, I'm Richard from Difference Northeast, and we are a campaigning charity that works to change perceptions of disability and tries to achieve more equal outcomes for disabled people in our region. And we are part of the Better Connected campaign group as well, working on digital inclusion in the region. And we joined that group specifically, I think, to bring our focus on accessibility, because that's one of the factors, as Adam explained, that determines digital inclusion. And we wanted to bring our kind of expertise on that. And I want to just share a bit about that, thinking particularly about, we've heard some great examples focused on learning disabilities, and I want to try and cover more broadly what providers need to think about when providing digital content in terms of accessibility. And we come at this from a social model of disability, where we believe that the barriers that create disability are generally created by society, by our environments, not by our medical conditions, but by the environments that we have to operate in. And in thinking in that way, we believe that we, as service providers and as healthcare providers, need to focus on removing those barriers and not looking at the individual as the problem, and not trying to always fix the individual, which is a tendency within the medical professions. Understandably, that's kind of what you do. But in terms of providing digital inclusion, you need to think about the barriers that are created by what you're doing, rather than the individual. So I'm going to run through, because we haven't got that long, a framework which I think might be helpful to you when thinking generally about inclusion and accessibility for your digital offering. It's called the PAW principles, and these come from the Web Content Accessibility Guidelines from the World Wide Web Consortium. So these are guidelines, technical guidelines, to help you make sure that your digital content is accessible. But it can be applied more broadly, and I think it's useful just to use it as a framework. So POUR stands for, so P is for perceivable, and what that means is just that not everybody is going to be accessing the information that you put out there digitally in the same way. People will have different impairments, which mean that the onus is on you as the information provider to make sure that you're putting content out there that people can actually see or hear or read in the way that they choose to, and the way that works for them. Now, this has been going on for years, and it's I can speak as a disabled person. I get incredibly frustrated when I go to my, and we just went recently to my local eye hospital in Newcastle, and every time I go, I say, can I have an electronic version of my next appointment, please? And I'm just met with like, they don't know what they want. It's like I'm talking a different language from another planet, and I get a letter which I can't read. And that's basic kind of stuff, but that's what we're talking about. Making health information accessible so that we're not relying on other people and the risks that brings with it. Another example, and I'm going to use some of my own examples here, but when I went for my COVID jab at the Newcastle Racecourse, there was a leaflet about that people are meant to read about risks before they have the jab, and of course that wasn't available in any of the format. So if you couldn't read that leaflet, it was tough. Now the information was available; it was hidden away somewhere on an NHS website, and that just needed to be found and made available to people. Not difficult, but it happens far too often, which is why we end up with health inequalities. So it is about making those alternatives available for people who might not be able to see your websites, or might not be able to hear if you've got video content. And it's about adding those captions, adding the text, giving just more options for people to access. The O in POUR is about, sorry, and just one further point on in terms of different options. Make help available so that if you know that it's very difficult to meet everybody's needs. So make help available, and this is where staff come in really important. That staff, you need to be able to give an option to say, look, if you have difficulties with this information or this part of our website, here's someone you can ring and get some support and get some help. O is for operable, and this means that different users of particularly assistive technology can actually use the information that you're putting out on your websites in particular. I find that often difficulties arise where websites haven't been designed properly, haven't been coded properly, and as a screen reader myself, I find that means I can just get stuck in the middle of a page, or often it comes up with things like filling in forms, digital forms. If they're not properly labeled, I can just end up in a form asking me for information I don't know what it is because it's not properly labeled, and I have to go and get help. And you might think that that's just a small thing. Well, yeah, I don't mind asking for help, but it's when you have to do that regularly, time after time, it does become quite onerous, and it erodes your independence. It puts pressure on relationships. You're asking friends and family for help, and it brings in risks that we've heard about. Another example, we were working with Sunderland People First, and an issue came up about on Zoom about people being muted to somebody who wasn't able to use the keyboard in the way that most people would. Wasn't then able to the meeting might require everyone to be muted, but then the person wasn't able to unmute themselves, and it was incredibly frustrating for them. We did eventually find a solution to that, but that's the sort of problem that people run into. So the way to think about this is really to be doing user testing, use the expertise that you'll have within your beneficiaries, your service users, get them to test it, take specialist advice. There are companies out there who will test your systems for you, and build that. You know, yes, it might cost, but start building that into your budgets when you think about new projects and new services. The U import is for understandable. So this comes back to issues around literacy and language. We know that literacy levels in this country are not high, and you need to think about, particularly for medical information being put out there, how easy is it for people to actually understand that. And we also know that in a medical consult situation, people are under a lot of stress. They're not taking information in. So we need to think about these issues, and we need to provide information in plain English and in easy read, so to help everybody access, and those documents will help everybody, not just people with learning disabilities. And then R is about robustness of information. So that's about different systems working, so that information is accessible whether you're using it on, for example, a tablet or on a phone or on a website, on a laptop. Whether you're using a screen reader or other types of assistive technology, it's about how well does that work across those different systems. And again, the key here is testing those systems out and getting some specialist advice. I'm just going to make one or two more points, then I'll hand over to Anya.
We need to go to the next slide.
Yeah. So a couple of general points. One of the ways that you can improve accessibility is investing in your staff skills, so that they are aware of some of these issues and how to make your information and your systems more accessible. And there are lots of organizations that do that. We do some of that. We've been doing it with the voluntary sector, and we have training available that can help. We're not technical people, we're not web developers, but you don't need to be. A lot of this is about having the mindset that says, actually, before I do this, I'm going to think about the accessibility, and I'm going to design it in from the beginning and make sure that everybody can access this information. And there are lots of free and easily available systems that can help you do that. You just need to know where to look for them. Talk to beneficiaries, talk to patients and service users. They will often have the answers as to what problems they have accessing your services. So involve them up front, not a kind of tick box consultation at the end when it's too late, but from the beginning. Don't make assumptions about what people with different impairments can and can't do. People are individuals, they will have intersecting disadvantage, they will have totally different circumstances, and their conditions will affect them differently. So it's a mistake to assume that, you know, all blind people will use this, or all deaf people will want this. There is so much variation, and as we've been hearing, you know, things like COVID has affected people very, very differently. Some things have been great, some things have been terrible. So really need to take a personalized approach and seek advice and guidance. Again, that's something that we can offer, but there are other specialist organizations like AbilityNet who can help you with things like website accessibility and developing apps. And that's all I really wanted to say about our kind of quick overview of accessibility. And I'll hand over to Anya, who's going to say a little bit more.
Thanks. Next slide, please. This bit's really just quite quick, just to say that there are some really neglected groups that people don't necessarily consider when they're thinking about accessibility. So one is asylum seekers, who typically have one of the lowest incomes available to them because they can't work and their asylum support is incredibly low. So their access to technology anyway is quite limited. They rely on very specific places. So making sure that if you are one of those places, to make sure that the way that people can get into things is really easy. Also to say that Doctors of the World translated loads of health guidance into multiple different languages. It's a really, really great resource. The link is there. That includes things like how to register for a GP, how to book a COVID vaccine, well-being guidance, loads of stuff. So that's a really helpful link, which also supports people with English as a second language, and that there's a really useful app at the bottom there called the Hemingway app, which can help you to lower the reading age of your text, either for a document or for your website. It does things like highlights when you're using passive voice, when you're not using passive voice, when you are using passive voice, how not to use that, and how to basically change your text to make it way more readable for lower literacy levels, which makes it more accessible. But that's it from me for now. I'll be in the next section too, but I don't know if that needs introduced or not.
Sorry, just clicking on the right button to unmute myself. Thank you very much, Richard and Anya. Some really interesting challenges there from Richard about just going to that next level of detail about and working with individuals themselves and not making assumptions about groups or diagnosis. I think that's a good challenge for us. I'm trying to write down some key points from each of the presenters that I can bring back as a summary at the end. And that's what that talking about that push towards involvement at the very earliest point in designing your pathway and services. It's something that we've talked about for years, but actually is critically important when we're thinking about digital and tech-enabled services. It's really important we get that right. Anya, we've now got the next section, which is starting to then think about, well, what we're going to do. You know, we've got people who are doing some great work out there. We've heard about some of it in the last hour and a bit. But actually, how do we then think about building some cross-sector partnerships? How do we build on that good practice? How do we move forward in the next 12, 24 months? And Anya, I think, is going to start with a presentation just to help us think about some of that. And then we're going to do a bit of group work around to get your ideas and your input into how we might do a little bit of that. Anya, over to you.
Hi. So I didn't really introduce myself before, but I work for the Collective Impact Agency, and we're all about systems change and trying to reimagine and recreate the systems that underpin the relationships that underpin the systems that we exist within. But I'm really here through Better Connected, which is, as Richard mentioned earlier, a digital inclusion campaign. The link's in the chat already. And we are a Northeast focused campaign that started in the pandemic quite early on in May 2020. So yeah, pretty early on for us. And we are a collective of organisations, which I'll go on to explain. Next slide, please. So as Adam was kind of talking about earlier, digital inclusion is a really complex landscape. And if we're going to succeed in improving the situation, we have to make sure that all of these factors work together and communicate effectively to share the right information and to avoid duplicating our skills too much, and kind of bring what we have together to make effective and kind of creative solutions that really work for people. So one of the first things that kind of really underpins what we do with Better Connected is understanding that digital inclusion isn't a binary concept. It's not that someone is excluded and then becomes included. It's much more fluid than that. A person can fall in and out of digital inclusion on a daily basis, especially when you're thinking about things like data poverty. So my dog's just decided to get up and start running around, if you can hear that in the background, sorry. So when we look at digital access, we think of it from a couple of different perspectives in relation to healthcare. The first is that it's a social determinant of health. If a person has no or limited access to the internet, they're more likely to struggle to maintain mental and physical health, especially in the context of how we're moving to a more digital by default landscape. And as services become more digitalized, that's going to become increasingly so. The second is that digital access needs to be seen as a gateway to our human rights. So when you think about how we are even engaging in this conversation right now, when we access our education, when we access healthcare, and as a few people have said, we need to order prescriptions online or use tablets to book GP appointments, even accessing food. You know, a lot of people rely on online supermarket deliveries. So we really need to see it as more than just a luxury. It's an absolute necessity for our well-being and our health, and basically enjoyment of all factors of life. Next slide, please. So our team at Better Connected, we aren't a constituted group. We're not a registered charity. We are a collective of organisations and individuals who are passionate about digital inclusion in the Northeast. We've identified a gap and a need, especially during the pandemic, and we decided to come together to work for change. So we've got a wide array of members that kind of shift and change all the time depending on people's capacity. But you can see some of them on the screen there. We have Connected Voice, Difference Northeast, Von, Adam from Not Equal earlier on is part of here as well, Digital Voice, a whole load of different organisations. We share our skills, our expertise, our time to collectively act on digital inclusion. So we give what we can when we can. There's no hierarchy in our group. We're really in this together, and we try as much as we can to take a shared responsibility, accepting that who has time and capacity changes all the time. We also acknowledge that we're not experts, because although we have a diverse range of skills, we haven't had every single experience of digital inclusion, because that's impossible. So as soon as we pretend, or as soon as we imagine that we're experts in digital inclusion, we're kind of wrong. We might know a bit, but we're never going to know all of it. Next slide, please. There's also lots of different concepts of digital inclusion, and for Better Connected, we look at it from 4 main areas. We look at it as access to up-to-date devices that are suitable for somebody's needs. We see it as being able to perform digital tasks that are required of you in school, work, general life, with the confidence that you need to do those things. We see it as someone being able to access software, websites, documents, and more, regardless of their ability, disability, whatever, like regardless of that they can access it. And we also see it as being able to afford and access internet connectivity and data that's necessary for the consumption needs of that person. There's also an important space for policy here. So without adequate policy, it relies on the goodwill of the various sectors involved to create and maintain solutions. So to achieve digital inclusion, we cannot work alone. No one organisation has the skills, as Adam said earlier, or the knowledge to be able to provide all of these things, but also we need these things to work effectively together. And that's why cross-sector partnerships are really crucial to challenging digital exclusion. So this approach that we have, and the 4 different areas, so the 3 different areas that we mainly focus in are on the screen there: data and equipment, accessibility, and digital skills. The one that's not there is our work with local authorities, but But working in this way has enabled us to get devices refurbished and out to people who need them, to develop and promote accessibility workshops, to provide links to skills courses, to have easy read and British Sign Language versions of all of our information on our website, to provide a variety of top tips, which are still under development. So if anyone's got anything they'd like to contribute, please let me know. And also to work with and lobby local authorities to improve their approach and policy. If this had just been the Collective Impact Agency or had just been Difference North East, we would never have been able to have done all of these things. It's purely working together that's enabled those things to happen. And the last slide is just some information. There's our website there, which you can visit. And if you want to have any conversations about anything we've talked about today, or you'd like to get involved, or even just join our mailing list, you can either go to our website or email us at betterconnectedne@gmail.com. So that's that. Look forward to hearing from you all.
Sorry, as the day wears on, I get increasingly slower at finding my mute and unmute button. Thank you for that. Really interesting around the idea around a collective, and it certainly got me thinking about how we use that collective approach to both support change but also challenge the system. So I think it's really interesting to be at the start of this conversation, and I don't think we're anywhere near yet. But what we wanted to do is to think as well with that, stimulating that kind of thought through what Anya's just told us around actually what else do we need to do in order to start getting some of these things right? What are the other activities that we need to engage in? How do we influence? Who do we influence? And what does that start to look like? So Charlotte, I think, is going to do something fancy with Slido, which I believe is the next slide.
Well, I say fancy with Slido. It's not a great tool to be using in a kind of a digital inclusion presentation. So apologies for that. It was kind of how do we kind of capture your feedback and insights in such a short space of time, and that will allow us to kind of explore something in between each one of our events. It's another reason why we've done quite a bit of engagement on social media as well today around this event, so people that aren't with us can understand more about what we're discussing, and I've been sharing all your links and your great reports and your toolkits that you've been providing us with. That's been really, really valuable. And if you're able to, if you can just log into Slido quickly, if not, don't worry, you can put it in the chat and we can put it in there for you. And the first question was really, what other activities do we need to engage in across the region to get digital inclusion right? So there's this event series where we're hoping to kind of pull everybody together that kind of has the interest and the passion and has these great reports and research into it. And we just really want to use that as well as our connections and inroads into healthcare and the support we're doing with the ICS and some of the programs we're forming on their behalf, about how we can take those insights and learning from you guys and help shape some meaningful change to services from everything we've learned through the pandemic. So people are just going on there now and inputting some stuff. So I should probably do the same. So I'll just do that now.
It's just for those who've not used Slido before, if you can either type in slido.com to your search engine, and then it will ask you for a joining number, and that's the hashtag 6867638. Or if you turn your camera on your phone and you hover over the square box, I can't remember what they're called. What are they?
QR codes.
The QR code. Thank you, Charlotte. If you hover
one of them pandemic buzzwords, Dave, you should know by now.
So if you hover over that, it will automatically bring up a link on your device, which you then can press, and it'll take you through the Slido. And what we're asking for is your thoughts and your words on what do we actually need to do together collectively? What are the activities we need to engage in to do that? So if you could join in one of those ways, that would be fab. If not, stick it in the chat box, email us afterwards, and we'll make sure that all of that gets inputted.
And I'm just wondering, we've captured so much within that chat. There's so kind of really rich conversations there. Sarah, is there any way that we can download this chat so that we keep that after the event and we can pull things out of that?
Yeah, it gets downloaded. Yeah.
Oh, that's great. Thanks. I was worried there. It didn't. Yeah, connecting organisations. I think today we've learned there's so much good stuff going on, and there's the opportunity to kind of connect and do more together, really, and kind of align what we're doing as well. Well, that's just got big all of a sudden. Yeah, skills training, refurbishing old tech. Yeah, set up a regular forum. I feel like this is like, I don't know about anybody else, but I've got so much going on in my head at the moment from all the good things that I've been listening to, is kind of just don't want to just leave it here for the next event in like a couple of months or a couple or longer. It's whether or not we can kind of regularly come together and just share what we're doing with each other. Yeah, don't reinvent the wheel. And they're taking primary care networks and ICS, and how do we bring them into a forum? Yeah, collate the research. That's something we can do, and we can feed back to you guys. And if anyone wants to support us with any of that, feel free. Share how we can help. Yeah. Yeah, I think that's really useful. Oh, thanks, Lindsay. You can't, if you want to see people. Yeah. Yeah, sure. That's a really good point. That's great. Thanks, Sarah. Do you want to go on to the next slide? And I think this is where we're going to go back into the feedback of the session. Is that right, Dave? About what people enjoyed most about the session. I'm really pleased that this is virtual and you can't see my face too much, because I was crying during those two videos of those lovely people that got the access to that technology. That was really powerful.
Yeah, that was my favourite bit as well. I'm just gonna, for those of you looking at me, I'm looking at my phone. I'm not reading about Steve Bruce being sacked. I am doing the Slido poll on my phone as we speak.
What's the next question, please? Is there one?
The next question was, what did you enjoy most about the session?
Yeah, there's some really good questions coming into the chat box as well around how do we ensure that we don't lose the local importance of some of the work, if we try and think about regional, that we don't widen inequalities. Adam makes a great note, or actually the report that already exists from IPPR has done a great starting point of collecting the research. Actually, it's a good go-to point for that.
I think
Richard, we'll make sure that comment goes in. Thank you, Richard. That was around the range and content of the speakers.
Yeah, I've received some great feedback about the speakers for future events, and getting people to come and talk about their lived experience. So people with lived experience coming and talking about their experiences. Saw some videos today, but it would be really nice to speak to hear from them, from people from.
That's great. We talked about that at one of our planning events.
Yeah.
That other people are thinking in the same way. Sure, if you can, Charlotte, you were breaking up a little bit there. I'm not sure if it was just me.
Oh, I don't know. It's probably because I was talking too fast. Sorry, Dave.
I think it's flashing up that my internet connection's unstable. So there you go. Just highlights everything we've been talking about, doesn't it? I wonder if we maybe move on to the next slide, and that's about future sessions. What other topics would you like to see covered? So we've got 2 more events, 2 more sessions, one in January and one in March. And what topics or content would you like to see in those digital inclusion sessions? One of which I think has got to be that lived experience that we've just been talking about.
Yes, local politicians, yeah.
That's really good, actually. I wonder if we could get some.
You'd have to find them first. Yeah, themed events, yeah. We should do an event with BT after that digitalisation of the phones things. I feel very 20th century, but I'd had no idea about that.
Oh, sorry, that was mine. I've typed loved experience instead of lived experience. I do apologise. Thank you, Harry. There's an offer of someone to come and talk about that lived experience from People First in Cumbria. Yes, Richard, I think that is something that we've talked about. How do we make these, given that these events are about digital inclusion, how do we make them as inclusive as possible? That's a really good challenge.
Yeah, rural areas need more focus with their internet black spot. I think my colleagues already identifying somebody that come and talk to us at another event about the move from analog to digital.
Yeah, I wasn't aware of that until today, so it's news to me. I'll have to.
That's great. That's great, and I think we've got another slide on the right.
I'm not sure we've got another Slido.
Okay.
I think the next one is the personal pledge.
Okay. Yeah, so the personal pledge was really just about kind of not just wrapping up the event. Wrapping up the event sounds like we're coming to to a harsh halt. We're not. I think we've got so much rich information from this event, and we're already starting to identify how we can take forward the next couple of events. But it's about what we can do in between the events to keep the conversation going, and whether or not you want to commit to a personal pledge or put something on social media using the hashtag. But I had a kind of a thought around if we can keep the conversation alive through on social media through the hashtag and doing some kind of tweet chats. I know that's not accessible to everyone, so please do give some other suggestions in the chats, please, around how we can kind of keep the conversation going, and taking into account what you guys were saying around collaborating and how we can pull kind of a lot of this together and create that forum where we can kind of come together regularly and just shape what each other's doing, and then kind of having a voice kind of a voice with the decision makers as well, and making sure that they hear some of this. So that's really what the pledge was about. I don't know if you wanted to say anything about that, Dave.
Yeah. It was just what I was talking about earlier. It was around if all the participants today from the session today make a personal pledge, if they're able to go and do something in the next week or two around digital inclusion, and that might be having a conversation with a neighbour, it might be having a conversation with a colleague, it might be raising it as a topic at your next team meeting, it could be reading one of the reports we've heard about or passing on a link. Just that small thing that we can actually own ourselves and we can go and do in the next week or two that might make a difference or might raise the profile. So if you're able to, we'd like people to put those pledges on the Twitter account and saying, this is what I am going to do this in the next week or two. Mine will be, get my Twitter account on to, I will go and have a conversation about some of this with the local ICS leadership group. That's going to be my personal pledge. And I'm also going to go away on a completely different level and have a conversation with my mum about that digital switchover in her landline, and actually how we start to think about planning a bit for that. So that will be my pledge. If you can't put it on Twitter for whatever reason, again, stick it in the chat box or email a friend or whatever. And there's lots going in the chat box already, so that's absolutely fabulous. And I can't get my Twitter open, so somebody else will have to tell me if people are tweeting or not, because I don't know at the moment. That's brilliant. There's already things going into the chat box, which is fab. So I think we'll just give people a few minutes to think about that pledge and make that pledge. Great, some great pledges going in there already. Lovely. Should we leave it there now? I think that there's quite a lot of pledges have gone in the chat box. People have clearly, we've clearly had an impact today with the stories that we've told and the things that we've heard. We've only got a few minutes left, and we've managed to pull things back round to time. I know that Anya made a plea with me earlier around not losing some of the discussion, so we need to work out as a group how we capture that. And I think I'm certainly committed to this idea of having a regular forum where we come together and we talk some of these things through when we make some plans and we think about how we challenge the system. So yeah, I think that's something I'm going to take away and do, because actually the richness of that today, just creating that space to do that, I think is something that we could probably help with. So yeah, I'm going to take that away. So some of my headlines from today were around very early, some of the things from Michelle and Adam around the really thing I picked up from Michelle is actually we don't really understand it, even if people can connect, why they're choosing not to. There's clearly some barriers there to using digital ways of connecting with health and care, whether that's a mistrust or a lack of understanding. But that's really interesting for me. It's not as simple as whether someone can or can't. And I think Anya said something later as well, really challenged some of my thinking about inclusion is a transient thing. It could be here today and gone tomorrow. And actually that's also a really good challenge for us. And Richard talking about how we can't make assumptions around accessibility. And we need to think about that from an individual point of view. And that's all of that together brings about just how complex this is, but actually that's no reason not to do it. You know, we've still got to work through those challenges, even though they are complex. I'm also going to take away the videos. I thought they were great, really powerful. That bringing that to life around actually not just some of the challenges, but actually some of the solutions and some of the ways that we can make a big difference, and that taking that positiveness out of those videos. I think those apps as well is something I'm going to go away, and the Hemingway app and Doctors of the World. I think that's something that we can promote. And the other thing I'm going to take away is just the richness of the conversation in the chat. And I think you're absolutely right, Charlotte, as we need to think about how do we capture that and reflect that back. So there's lots of things that we can go away and do. Seems to be there's a lot of love in the room for some kind of forum, regular forum for bringing people together and having conversation and discussion. And Charlotte and I and the team will take that away. And I think that's something that the Academic Health Science Network could definitely support with. So we'll take that away. This is just the start of the conversation, I hope. We're all on a similar journey, so let's connect. Let's keep that Twitter conversation going and keep digital inclusion as high up the agenda as we possibly can. Thank you for everybody for your time today, particularly to the people who've taken the time to prepare presentations and present and share their journeys and share their successes and their challenges. Really, really appreciate that. We've got another event planned for January 17th. There's an opportunity for everyone to influence that. So drop us a line, get in touch, tell us what you want us to do. Really good session. Thank you ever so much. That's made my day. Thank you very much.